Today, children will die as a result of an epidemic it is well within our power to address. Nursing mothers will ignore essential medical advice. Senior citizens will take overdoses of prescription medication. And in every city, in every nation on the planet, people will be victims of violent crime, will decline into poverty, and will lose their homes. But despite the fact that this epidemic affects 1 in every 4 people on the planet, governments and multinational agencies continue to effectively ignore it, wrongly believing that this epidemic is an educational challenge as opposed to a global health crisis. Let me try to put this into perspective. 4,887 people. This is how many people lost their lives in Liberia and in Sierra Leone during the course of the Ebola outbreak. And every one of those numbers represents a tragedy, not just for the individuals concerned, but for their families. We think perhaps most readily about the brave medical staff who are among that number, who tended to the sick despite being aware of the dangers to their own health. During the 9 months of the key areas of the outbreak, roughly $1 billion was spent by national governments and multinational agencies trying to address that crisis. During that same year, less than 1/3 of that money was spent on education of all kinds in those same countries. From kindergarten to primary school, to secondary school, to vocational education, further education, and higher education. 21,000 children die from preventable diseases every day. You're probably aware of that statistic. It receives a certain amount of attention, as it should. What you may not be aware of is that a child who is born to a literate as opposed to an illiterate mother is 50% more likely to survive past the age of 7. And there are other ways in which literacy or illiteracy affects people. A woman living in sub-Saharan Africa who is literate is 3 times more likely to understand that an apparently healthy suitor may in fact be infected with HIV/AIDS. And as ever, it's women and girls who are those who suffer most from an epidemic of this nature. Yet it's been established that investment in basic foundational literacy education would cut the global rate of maternal deaths by 2/3. And there are other ways in which women become victims of this epidemic. This is Ghulam, a Yemeni girl, pictured on her wedding day. Ghulam is 11 years of age. It's been demonstrated that effective literacy education programs can cut the incidence of child marriages in the nations where that practice is still in place by 15% a year. And the health implications of child marriages, both physical and psychological, are exactly as you're imagining. And let's not imagine that this epidemic only affects developing nations or particular communities. A 2012 survey of US public hospitals discovered that only 4.5% of their illiterate patients understood the advice given to them by their doctors or printed on the labels of their prescription medicines. Because illiteracy is a global issue. It probably won't surprise you to know that the illiteracy rate in Addis Ababa is 60%. It might, however, surprise you to realize that the illiteracy rate in Philadelphia in the United States is over 40%. But we shouldn't dwell simply on the negative impact of the failure to address the illiteracy epidemic, because there are positive things that can come out of direct action. The World Bank have said that the huge disparities in socio-economic health outcomes would effectively be eradicated through effective literacy education. Child mortality rates would decline and life expectancies would increase. But there are very significant barriers to delivering effective literacy education. And the formal education system on its own cannot carry the weight. we have 1.7 million too few primary school teachers. There is an enormous shortage of literacy education texts in minority languages. In some cases, there are none at all. And bear in mind that of the estimated 7,012 languages on the planet, more than 90% of those are spoken by less than 100,000 people. Another challenge we face is that an estimated 31% of illiterate people live in illiterate homes. In other words, they live in a home where nobody can read or write, no parent, no peer. Providing people living in such homes with a printed text is about as effective as giving them a rock. And what about, as we try to address those challenges, what about the people who get left behind? What about the lost generation while we try to deal with those very foundational issues? All of those who have missed the opportunity to attend school, including some of those who would most benefit from literacy education. We think of people like nursing mothers, budding entrepreneurs, community workers, because it's a sad fact that of the estimated 130 million children of school-going age who are currently out of school, 47% of them will never attend a single class. And illiteracy, to a degree, is an epidemic for which the vaccine may already be in people's pockets. I'm sure you're all aware of the statistic which shows that there are now more mobile devices on the planet than there are people. What you may not be aware of is that this very month, India passed the United States in terms of the numbers of active individual internet subscribers. And that number is growing exponentially. The educational power of mobile technologies is enormous, but it has yet to be harnessed. For the past 2 years, we've been working with UNESCO and leading NGOs, including World Vision, to build and deliver sets of cloud services, services that will allow people with any type of mobile device to connect to hosted content, to create and deliver key surveys to identify baselines, to check progress, and then to provide that analysis back to system planners. We built a system which allows anyone, anywhere, to write and publish a literacy text in any language. And those books actually are more than simply words and pictures. They combine text and illustrations, but also warm spoken narration. Now, this is not to suggest that technology can or ever should replace the role of a teacher or a parent. But if you think about the scenario we described, where within a home, neither the mother nor the child can read, the essential foundational literacy education experience is a child sitting on its parent's lap and learning to read. In this instance, technology can actually scaffold that experience by allowing the child and mother to sit together, and the technology to allow them to hear a book and to learn to read together. So if there's such enormous potential in mobile technology, why hasn't it changed anything? Why have we not seen shift? I believe there are two key reasons for that. The first is that, although a mobile device like this can host up to 20,000 such texts, they're still quite expensive, and they're still quite limited in their functionality. Both of those things, however, are changing and changing rapidly. I very much doubt if anyone here would happily swap the device they have in their pocket now for the one they used 3 or 4 years ago. And in fact, in independent research conducted by UNESCO in 2013, they determined that digital literacy solutions were significantly more cost-effective than traditional methodologies, that they would be cheaper than the cost of printing, shipping, storing, and distributing printed books, that they would be significantly cheaper than the cost of human assessment and engagement. Because a device of this kind and cloud technologies don't simply allow people access to content, but they capture information and data through usage. So we can determine on an individual level when someone has finished reading a book. I was an English teacher for a long period of time. I could never tell if anyone had actually finished a book that I prescribed. It would also allow us to see where best practice was emerging, so we could share that best practice elsewhere. It would provide information back to system planners to allow them to make quick interventions rather than having to wait till the end of a reading program to find out if it was working or not. So there are significant challenges in this area, but maybe the biggest one is not the cost or ability of the devices, but the issue of connectivity. Because the reality is, for large parts of the world, there is no connectivity to either internet or cellular networks. Now, there is some major advances being made in this area. I think of something like TV white spaces, for example, which employs unused parts of the television spectrum to effectively broadcast very low-cost internet access into some of the most remote regions. But it's going to take a huge concerted effort for all the agents involved to bring about a change in connectivity access. From the telcos, from the technology companies, from national governments, from multinational organizations. And one of the challenges has been that for a long time, commercial concerns in particular have looked at developing nations as emerging markets, first of all. The reality is those markets are huge and getting bigger anyway. But the issue of illiteracy is enormous, and the need is urgent. We need to move from a competitive approach where each of those agents are trying to show that their technology is better than another, towards a collaborative approach. And I would appeal to all my counterparts in the telecommunications companies and the technology companies who have global bases here in Ireland to join with us in this effort to try and extend access at scale. And when we're looking at this through a commercial lens, we shouldn't disregard the cost of illiteracy to nations. Take Japan. I'm sure Japan is not a nation that you would assume would have a massive illiteracy problem. And actually, in percentage terms, it doesn't. Yet they estimate that the cost to national expenditure every year of illiteracy is $87.8 billion US. Not because that's the cost to education, but because illiteracy affects both income generated by the populace, because illiterate people and illiterate nations earn less, and outgoing in terms of expenditure on things like health problems, but also things like national security and justice. Over 70% of all prisoners in the US penal system are functionally illiterate. The global cost of the illiteracy epidemic is estimated at close to $2 trillion every year. A sum of money that should be invested in literacy education because the rewards it would generate would be significantly higher year on year. And something else I actually only discovered last week in preparation for this talk, which is really fascinating, that the process of learning to read and write affects it almost at a molecular level. Learning to read and write reshapes and rewires our brains. It contributes to brain development in a way that nothing else can. Its absence has a similar effect. Treating illiteracy as an educational challenge has proved an abject failure. I don't know if you're aware of the UN Millennium Goals, but just to share with you that all 6 of the targets set for the Millennium Goals were missed. Not only that, but in research UNESCO conducted at the end of that period, they discovered that rather than literacy rates increasing between the year 2000 and the year 2015, the number of people on the planet who are functionally illiterate has actually increased over that time. Imagine for a second that there was a virus that was killing people globally of all ages. Children, youth, young mothers, adults, older people. Imagine further that that virus directly affected the proliferation of other diseases, helped the spread of viruses such as HIV, AIDS, and others. Imagine that virus could bankrupt both people and nations and had a direct effect upon the likelihood of nations becoming involved in violent conflict. And then let's imagine that we had a vaccine. Would it not make sense to invest in it? I want at this point just to add a personal postscript. The title of my talk today is sick, and I also have a sickness, or to be more exact, I have a mental illness. I have bipolar 2. It's not something I'm ashamed of or proud of, it's just, it is what it is. But I would like to address anyone here or watching this who also belongs to the 4% of the population who either have a mental illness or at some stage in their life will suffer from one, to just think about a number of things. It doesn't matter to a large degree if you have a mental illness. The stigma is something we have to address. But the reality is that, yes, you should seek help. Yes, you should take your meds. But you should also take heart, because an increasing number of companies, including the one I work in, Microsoft, now have active diversity employment programs in place. Not so as to meet quotas, but because they've recognized that people who are differently abled or who have conditions such as bipolar or autism bring with them into a workforce unique skills, experiences and talents. In fact, it's been categorically proven that diverse teams consistently outperform non-diverse teams. Mental illness will not prevent you from forming and maintaining a loving relationship. It will not prevent you from having a family or being a good parent. It will not prevent you from finding rewarding work or from having a successful career. Perhaps more importantly, it will not prevent you from having the opportunity to make a valuable contribution to the companies in which you work and to the communities in which you live. Thank you.